Hello students, so welcome back to the channel. In this video, we are going to study about the growth hormone, which is the most important hormone produced by the anterior pituitary. Now see beta, we have already seen in the previous videos that hypothalamus will release growth hormone releasing hormone, which will enter into the anterior pituitary, and then anterior pituitary somatotroph cells. Okay, somatotroph cells, they will release growth hormone. The growth hormone is also known as somatotrophin. Is it clear? It is also known as somatotrophin because it is released by the somatotroph cells. Now, growth hormone, name is itself indicating it is helping in the growth of an individual. So it is stimulating the growth of the bones lengthwise as well as in width also. So it is having an indirect effect on the growth, but it is also having the direct effect on metabolism. Now see beta, the somatotroph, I told you somatotrophs are the cells which are going to produce growth hormone. So they are the most numerous cells and they produce growth hormone. So that is why growth hormone is the most plentiful anterior pituitary hormone. Clear beta? Now it promotes growth. Name is telling it's promote growth of the body tissue including bones and skeletal muscles. And it also regulates certain metabolic process also. So how it is promoting growth? See beta, growth hormone is exerting its effect on growth of the bones or the things by indirectly. So it is exerting its growth promoting effect indirectly by producing insulin-like growth factor. So growth hormone is doing two work. One, it is responsible for the growth, name is telling it, but it is indirectly it is doing it. Okay, this work is indirectly done by the IGF. And who is producing IGF beta? IGF, see beta carefully. The cells in the liver, skeletal muscles and cartilage and bones, they will secrete IGF. So because of this insulin-like growth factor, the growth is going on. Okay, second effect of the growth hormone is not growth, it is metabolism also. So metabolism, it is direct effect. Okay, beta, focus beta. Unlike the effect of growth hormone, the effect of growth hormone on metabolism is direct. The effect of growth hormone on body growth is indirect, but on metabolism, it is direct. Clear? The body growth effect is indirect, but on metabolism, it is direct effect. Please remember this way, on metabolism, it is having a direct effect. Is it clear? So it is having the body growth effect. How? It is using IGF as a mediator. It is causing the growth of the bones and other tissues, and directly it is growth hormone is directly controlling the metabolism. Clear beta? So we can explain this way कि hypothalamus, when it release growth hormone releasing hormone, then pituitary gland will release growth hormone. And this growth hormone will then target liver, bones, cartilage to secrete IGF, insulin-like growth factor, which will cause the growth of the bone. And this, here we can say, directly effect on metabolism. Clear beta? Let me show you one diagram. You can see beta, this is hypothalamus. Clear? When hypothalamus is releasing it, then see beta anterior pituitary. This anterior lobe of pituitary is secreting growth hormone. Growth hormone is having direct effect on the metabolic process, and it is affecting the liver, bones, skeletal muscles, and cartilage to release IGF, which will cause the growth of the bone and the muscles and other tissues. Clear, beta? Now, how do they cause the growth of the bone? Let me explain you that concept. Now, see, beta, in this diagram, I'm trying to explain you how the bone growth is going in length. If you see, this is a long bone, we have taken it, and the end of the long bones are known as epiphysis, and the middle part is known as diaphysis. So this is known as epiphysis. Clear? End is known as epiphysis. And this middle part, okay, but this middle part is known as diaphysis. And at the junction of the epiphysis and diaphysis, here it is an epiphyseal plate is present. So you can see here the diagram. This is epiphysis bone part, both sides. Okay, they have shown only one side. And this is diaphysis. In between, you are finding in between epiphyseal plate. Clear, beta? Now see, in the epiphyseal plate, you can see down, beta, focus the diagram down. In the epiphyseal plate, you are finding these are the chondrocytes, means cartilage cells. Okay, beta. Now, what is the first step? How do the bone increases in length? First of all, chondrocytes will undergo cell division. So as a result, they are thickening the epiphyseal plate. So you can see, beta, bone of epiphysis is moving out. Now, as a result, what will happen? The older cartilage chondrocytes will become large. If they go for cell division, we call this process as hyperplasia. And when they become big in size, then we call it as hypertrophy. Now, as a result, what will happen? Extracellular matrix will calcify. And the entrapped chondrocytes will die. Clear, beta? I hope this labeling, every labeling you are able to focus, beta. So first of all, chondrocytes will undergo cell division. Then old chondrocytes will grow large. And when the extracellular matrix is calcified, the entrapped chondrocytes will die. Now, when the chondrocytes have died, they are being cleaned away by the osteoclast. Osteoclasts are bone-eating cells. They are eating it away, okay? Old and dead chondrocytes will be eaten by the osteoclast. Then bone-forming cell, means osteoblast is bone-forming cell. They will move up from the diaphysis, they will move up and they will deposit bone over remaining of the disintegrating cartilage. So as a result, if you see diaphysis, this part, if you see carefully, the diaphysis will slowly will increase in the length, and again epiphyseal plate will come back to the original. Is it clear, beta? So this is the way how the bone grows in length under the influence of the growth hormone or through IGF, which is used as a mediator secreted from the liver or other tissues, and the bone grows in length. If suppose the person is consuming some steroids, then these are the centers which are responsible for the growth, epiphyseal plate will close and it will lead to the stunted growth, means the person height will not increase. Now, if you see, when the child is in the puberty, that time he is increasing in the height just before puberty, it is increasing in the height, and after particular certain time, slowly later on what will happen? This epiphyseal plate will be ossified. Now there will be no cartilage cells. As a result, the growth of the child stop. And this will be under the influence of the hormone somatostatin, which is secreted from the hypothalamus. Okay, hypothalamus is coming and trying to now stop the work of the growth hormone by closing the epiphyseal plate. So I tried to explain you how the growth hormone is responsible for making the child tall. Now, if suppose overproduction of growth hormone is going on, if overproduction of growth hormone is going on, then the person will be suffering from gigantism. And if suppose underproduction is there, then he will be suffering from dwarfism. We call such dwarfism as pituitary dwarfism. Reason is that hormone is coming from pituitary gland. Is it clear? And if suppose the excess growth hormone comes in the adult, as a result, the bones of the faces, especially, they grow. then that condition is known as acromegaly. See, beta, this only I try to focus. Overproduction of GH stimulates abnormal growth of the body, leading to the gigantism. So one disease, gigantism, is because of the overproduction. And low secretion of growth hormone resulted in the stunted growth, which is known as pituitary dwarfism. The disease is known as pituitary dwarfism. And if overproduction is occurring in adult, overproduction of growth hormone in adult, okay, it leads to acromegaly. In adults, it leads to a disease that is known as acromegaly. Clear, beta? See, beta, this is at the age of 13. See here, normal height and everything, normal facial. Slowly, because of the excess growth hormone in the adult, see, at the age of 35, over facial bones are growing and it leads to a disease that is known as acromegaly. Clear, beta? So according to the NCERT, I have covered it. But let me teach you a little bit extra, because when you're solving few competitive questions, then this topic they are asking more in detail with respect to metabolism. So let me explain you how does it affects metabolism directly. Now see, let us study better what is the effect of growth hormone and metabolism. First of all, it will increase lipid breakdown. So we will say it will increase lipolysis, and it will lead to the increase in fatty acids in the blood. So that the cell can take the fatty acid and can use it for the source of energy. The fatty acid is used as a source of energy. Now it is not allowing the glucose to take this, it is not allowing the cell to uptake the glucose. So second effect is it decrease uptake of glucose by cell. So it means cells are not able to take the glucose because it is leaving the glucose for the neurons, because neurons cannot use any other substrate. They can use only glucose. So as a result, the blood glucose level is increasing because it decreased the uptake of glucose by cell. Are you understanding me? Once again, I'm trying to explain. It does not allow cell to take the glucose because it wants to leave the glucose more for the neurons. Okay, as a result, blood glucose level increases. So as a result, blood glucose level is increasing. And that is why we say it is responsible for diabetogenic effect. It is responsible for diabetic, like just like in diabetes, we say that the person is having the blood glucose level high. So we say it is a diabetogenic effect is going on. Then third, it will increase the uptake of amino acids by the cell. It increased the uptake amino acids by the cell so that they can produce more and more protein. So this is the effect of growth hormone on metabolism. Main question is this. This is important. It is having diabetogenic effect. Reason why? Because it decreased the uptake of the glucose by the cell. Why it decreased the uptake of glucose by the cell, beta? Only for one reason, so that the glucose can be available for neurons. Is it clear? So growth hormone is having this effect on metabolism. So thus in the short, we can say that growth hormone leads to increase in fatty acid in blood. It leads to increase of glucose level in blood, but it leads to amino acid level low. Okay. So these are the major effect of the growth hormone on metabolism. I hope this extra information for all your other competitive exam also will help you to understand properly. So I think so today video in which we discuss the growth hormone, I tried to explain you how it is released, under influence of which hypothalamus hormone it is released. and what is the effect, how it is producing effect on the growth of the bones, and how it is affecting the metabolism. And if suppose the after a certain period of time, then the epiphyseal plate has to close. For this, the hypothalamus is directly secreting a hormone that is known as somatostatin, which inhibits the work of the growth hormone. So I hope so this video, you must be finding it useful for you. Thanks for watching, Beta.